Hi there viewers. Welcome to our channel. The ovaries are part woman's reproductive system, and there are two of them. They are located on either side of the lower abdomen. At the midpoint of each menstrual cycle, these two ovaries produce and release eggs into part of the female reproductive tract, the fallopian tube, where fertilization via sperm may occur. Where does ovarian cancer occur? Ovarian cancer starts inside the ovaries and then becomes a cancerous tumor that grows outside the ovaries, and the cancer cells divide uncontrollably. This is when it destroys nearby tissue or even spreads to other parts of the body, such as the liver, lungs, spleen, uterus, bladder, sigmoid colon, intestines, brain, and other organs in the body. So, why are we talking about ovarian cancer? Ovarian cancer is considered one of the silent killers. This is because women who have cancer may not be aware of it until it spreads to other organs in the body. Therefore, it absolutely makes sense to take preventative measures because of its high mortality rate, particularly if you have a family history of this cancer. Ovarian cancer affects around 22,500 American women each year, according to the American Cancer Society. Also, according to the National Library of Medicine, ovarian cancer affects around 7,500 women in the United Kingdom every year, and also 6 in 10 cases of ovarian cancer are diagnosed in the later stages, stages 3 and 4. Know that we defined ovarian cancer. What are the 3 types of ovarian cancer? Ovarian cancer is categorized based on where the cancer started. Therefore, these are the 3 categories. Number 1. Epithelial tumors. These tumors start in the thin layer of tissue that covers the surface of the ovaries. Epithelial tumors represent up to 90% of ovarian cancers. Number 2. Stromal tumors. These tumors are known to be diagnosed at an earlier stage of cancer in comparison to ovarian tumors. These tumors start in ovarian tissue and represent about 7% of ovarian tumors. Number 3. Germ cell tumors. These tumors start in the egg-producing cells. These types of tumors are scarce and known to occur in younger women. Now that we know about ovarian cancer and its categories, we can move to talk about some diagnostic techniques and technology that specialists use. So, how is ovarian cancer diagnosed? For ovarian cancer diagnosis, a doctor may use many different types of tests and exams. Number 1. Pelvic exam. The purpose of this exam is to check any visible abnormalities. This exam involves checking the vulva, vagina, cervix, ovaries, uterus, and rectum. Number 2. Imaging tests. These tests include ultrasound, computed tomography, positron emission tomography. These tests show the size and the shape as well as the structure of the ovaries. These tests also detect any pelvic masses. To determine if ovarian cancer has grown and spread, the doctor uses colonoscopy, chest X-rays, magnetic resonance imaging, also called MRI. Number 3. Blood tests. In the blood of ovarian cancer patients, there may be high levels of certain tumor markers in the blood, such as CA125. This is the protein that is found on the outside of ovarian cancer cells. Therefore, this blood test confirms the existence of this protein. This blood test is also used to detect chorionic gonadotropin, alpha-fetoprotein, and lactate dehydrogenase in the blood. Number 4. Biopsy. This biopsy test is mostly used to make a definitive diagnosis after completed the above-listed tests. This is when the doctor obtains tissue and abdominal fluid samples for the pathologist to examine them closely using a microscope to determine the presence of cancerous cells. Know that we know the 3 types of ovarian cancer and how it is diagnosed. How fatal is ovarian cancer? As I mentioned before, ovarian cancer can spread very quickly to other organs. This is because its symptoms can be mixed up with other health conditions or illnesses. This makes it very challenging to detect and diagnose, which leads to delay in medical interventions and treatments, and therefore it spreads to other organs in the body. And this is when the cancer becomes fatal. Whenever we develop a health condition, our body gives us some crucial signs and symptoms that we need to watch for. So, what are the top 5 symptoms of ovarian cancer that you need to be aware of? Number 1. Pain. The types of pain we are talking about here are unexplained cramps, painful pressure in the pelvic area, abdomen, or stomach. These types of pain can be continuous and severe. This is when you seek medical attention and intervention. Note, never assume these symptoms are related to your menstruation. Thus, make sure you get medical advice from your doctor. Number 2. Urinating more frequently than usual. This is one of the direct effects of ovarian cancer, and this is when you feel the need to urinate more frequently, but little comes out when you go. You may even experience difficulty in holding urine on your way to the bathroom, and also urges can come on quickly. You may also experience urinary leakage without even trying to pass urine. Note, frequently urinating may also be associated with a urinary tract infection, UTI, or an overactive bladder. However, if this sign is a new health condition to you and continues for days, make sure you seek medical advice from your doctor because it can be serious if ignored, being one of the signs of ovarian cancer. Number 3. Unexplained bloating and abdominal distension. Ovarian cancer can produce gas and block it from being released, leading to abdominal bloating that can be uncomfortable. If this symptom is new to you and persists for days, make sure you seek medical advice. This is because bloating can be associated with fluid buildup in the abdominal cavity at the end stage of ovarian cancer. The degree of abdominal distension may range from mild to severe, accompanied by mild indigestion. This bloating mostly occurs daily, and it can even get worse with time. You may not be aware of this bloating until it is too late. Therefore, it is crucial to pay attention to your clothes and check if they are tight around your waistline, knowing that you haven't gained any weight recently. Note, if you developed unexplained and expecting abdominal distension, you may develop stretch marks. Also, never assume that the bloating you are suffering from is related to age, or menopause, or from gaining a couple of kilos. This is because unexplained bloating can be an early sign of ovarian cancer, especially if you feel bloated for more than 2 days. Therefore, if you ignore this symptom, it will lead to serious and complex health conditions. Number 4. Unexplained lower back pain. If this sign is new to you and you didn't have problems with back pain before, this may be a serious sign that you need to pay attention to, especially if it is similar to labor pain. This is because when cancer spreads outside of the ovaries, it causes lower back pain, and this pain is mostly from tumor growth and the tumor compressing on other organs in your body. Number 5. Constipation. This symptom is often overlooked by so many women, associating it with other health conditions or food-related problems. However, when the ovarian tumor spreads, it can cause constipation, and this is by putting pressure on the bowels. Therefore, constipation is a typical sign of ovarian cancer. Thus, it is very critical to pay attention to any changes in your bowel habits, especially if it is new constipation that doesn't go away, even with interventions that you may have tried. Number 6. Vaginal bleeding. The bleeding we are talking about here is the bleeding that is no normal, such as heavy bleeding, irregular bleeding, and bleeding between periods, particularly after menopause. You may even experience frequent discharge from the vagina, and the color of this discharge can be clear white or colored with blood. Number 7. Pelvic pain or pressure. This is a very tricky symptom because it resembles the pain you would get when you have menstrual cramps, but this pain can be an early sign of ovarian cancer. This kind of pain may be confined to one side, but can also be felt all over your pelvis. Therefore, make sure you consult your doctor if this pelvic pain persists for few days, particularly if accompanied by a feeling of pressure in your pelvis. Number 8. Pain with intercourse. This is called dyspareunia, and it is a common sign of ovarian cancer. However, this symptom can also be related to pelvic inflammatory disease. Therefore, it is best to always consult your doctor for a proper diagnosis. Now it is your turn. What are the signs you may have experienced if you have developed ovarian cancer? Please share your experience in the comments below. Please remember to like and subscribe to our channel. Thank you.